It's just been one of those days. I'm really sorry. Again, this is Dr. David Geier and Ask Dr. Geier Live. I apologize for those of you that could not hear me. Let me go real quick through what I was just saying. This is the one place that I answer your orthopedic, your regenerative medicine, your health and wellness questions. Leave those in the chat, not in the comments. If you're on YouTube, I can't see the questions in the chat, so definitely do that. If you're on X and I'm not answering your questions, then maybe go over to the YouTube channel at Dr. David Geier, DrDavidGeier, and again, leave those in the chat. Sometimes the X comments come through, sometimes they don't. And also, as always, please remember this is not medical advice. I haven't seen you, haven't examined you, looked at X-rays, MRIs, anything like that. As it says in the disclaimer below this video, it's not medical advice. It's meant for general information and educational purposes only. All right. Yes, we had some audio issues, and I apologize for that. And I was caught up responding to a couple emails, or not emails, but texts, urgent texts from my practice, and got just caught up doing that. All right, ask your question. Feel free. And if we don't, it'll be a very, very short episode. Let me see. Other than everybody talking about not being able to hear me, I hope everybody has a great time. I'm recording a new batch of videos next week for those of you interested that follow my videos on this YouTube channel, and I'm assuming people do. I'm very, very grateful for the 111-ish thousand subscribers, but going to stick to the Ask the Doctor videos. Those have been very helpful, or very well received. People have asked lots of comments and asked a lot of questions on those that I may try to answer in Ask the Doctor videos. I have a couple product videos I may demonstrate here in the next couple of months too. That could be entertaining for those that like watching new health and wellness things. All right, Mike says, let me see if I can get this on the screen here. Mike, had a meniscus repair, a year later meniscectomy on the inside part of my knee. My leg slipped a little bit, felt no pop. So the trick with, and he didn't really ask this, well, let me get to the second part of his question. Leg hurts, feels unstable. Is there a higher chance of the meniscus re-tearing? So there is, after a meniscus repair, when they go in and sew the meniscus together with stitches or anchors, those have a failure to heal rate somewhere between 10% and, as some studies show, as high as 40%. So it's possible those don't completely heal. You basically can twist it wrong. You end up with back exactly where you were. That meniscus re-tears or tears worse, and then they have to go in a second time and do a meniscectomy. That may have been what happened in his case. After a primary meniscectomy, you're not typically, studies have never shown an increased risk of re-injury in terms of something like an instability episode, ACL, something like that. What is likely to develop, as I talk about a lot on these shows, is the development of arthritis changes over time. Much, much higher risk of developing arthritis after a partial meniscectomy than somebody that hasn't had one. That's largely why we try, if it is a repairable meniscus tear, we try to do that, because very often they lead to arthritis if you trim part of it out. Unfortunately, there's not much you can do about that. 85-ish% of meniscus tears, especially in adults, are not the repairable type of meniscus tears. Mike says, glucosamine, chondroitin, sulfate, thoughts, just started taking it, changed my PT regimen for tendonitis, kind of hoping that glucosamine and chondroitin isn't doing anything, and it's actually the PT helping. So I'm lukewarm on glucosamine and chondroitin. The studies are not terribly good, maybe a little bit better than placebo. There are some studies that show that maybe it's close to as good as anti-inflammatory medications, which I'm not big on for a different reason. I have no issue with it. Really no side effects. The big risk would be it doesn't work and you've spent a lot of money on it, because you have to use it usually for a couple of months before you see if it's going to work or not. So I'm fine with it, especially for early arthritis changes, not something terribly bad, not in need of injections, regenerative treatments, that kind of thing. Doesn't need surgery. I'm certainly fine. I am a big, big proponent and fan of physical therapy. So I think, again, don't know in your case, not medical advice, but my guess would be that it's at least somewhat, improvement would be somewhat related to the physical therapy. Thoughts on stem cells to repair scarred tissue after an arthroscopic surgery? You can grow cartilage with stem cells. I've tried it. So far it's been helpful. That's a tough one to answer specifically because I don't know specifically what the surgery was, what the scar tissue is. I don't know that stem cells would have any effect on scar tissue after an arthroscopic surgery in any joint, shoulder, knee, hip, ankle, elbow. I do think stem cells would potentially be helpful, and that stem cells is a huge category and there's a lot of caveats, so I'm answering this sort of generally, but in two phases. One, to strengthen the repaired structure, whatever that is. That would be, actually, I'll just go that one, but let's just say ACL. Maybe it makes the ACL graft stronger and incorporate faster. Rotator cuff repair, maybe it would strengthen the repair and the interface between the rotator cuff tendon and the bone, helping it heal faster, helping it heal stronger. So I definitely think there can be some use for that. Sort of the same reason PRP has been used during or shortly after arthroscopic surgeries, mostly during. Exosomes in the same kind of way could be helpful. People sometimes ask me about peptides during or shortly after surgery. I don't know that peptides necessarily would make a big difference on the repaired structure. I guess in theory it could if something like BPC was injected into the joint, but certainly potentially could be used to improve and speed recovery from whatever that surgery is. So I know it's not a perfectly clear answer, but there potentially could be some roles for that. He says, my hope is to slow down arthritis with stem cell shots. Some cases have reversed arthritis from level 3 to level 2. Yeah, the studies are all over the map with stem cells. I think it's very encouraging progress. And I like it. I typically use autologous exosomes, so it's from your body, so you're not getting them from a donor. And I've had, I think, very good success rates with exosomes. I'm really more looking at decreasing pain and improving function. If it improves cartilage and subchondral bone to improve arthritis, even better. But even if it doesn't, I've been very pleased with the progress in terms of pain and function in patients with early, moderate, even severe osteoarthritis. There is thought the earlier you get to it before it has become arthritis, these regenerative treatments like stem cells, like PRP, like exosomes might be even more effective. Any updates on getting penicillin approved? I have not heard anything. I have 2 patients that have become stockholders because they liked the penicillin so much and they knew it was coming to the United States, and so they bought stock in it. And I haven't seen them in a while, but they, at least for a while, were filling me in on the progress of the phase 3 trials and what Paradigm, the company that's bringing it to market, was saying about when it would be. So I've said a lot. It was fast tracked by the FDA in 2022. You remember the COVID vaccine and fast track. This is obviously a slower process because they don't see it as something that urgently needs to be brought to market. But having said that, hopefully the next year, 18 months is probably what I'd guess. But no, I don't unfortunately have any updates. I wish I did. If I don't trust the ortho that's done my last 2 meniscus surgeries, need ACL, would you advise looking for a different orthopedic specialist to do a major surgery? I can't speak for that specifically in terms of Ohio. This is what I would say about an ACL reconstruction, and I've done over 1,000 of those. I don't operate anymore as I've pivoted to regenerative. But having said that, numerous studies have shown this is true with hip and knee replacements. It's true with ACL surgeries, been shown, and I suspect it's would be true for a lot of complicated orthopedic surgeries, whether that's sports medicine, joint replacement, spine, anything. Is you want that surgery done by a surgeon that does hundreds of those a year, certainly 100 of those a year, and not 5 or 10. And there are, especially across the country, still general orthopedic surgeons that never did a fellowship training, never subspecialized, that do a little bit of everything, and the complication rates are higher, whether it's joint replacements or ACLs, and the success rates are lower. That's not necessarily a criticism of them, but yes, if it was me or somebody in my family, I would strongly recommend orthopedic sports medicine that does a large number of ACL surgeries. I think that can be very, very helpful. Mary says, good day, hip replacement at the end of May. I hate to hear that. You just hate to hear that. Have trouble building muscle. What can I do? Walking with a limp. So she is now, let me do my math here, 4 months out, almost 4 months out from a hip replacement. So one, and I would be very surprised if Mary isn't doing this after a hip replacement, very big, as I said earlier, proponent of physical therapy. That can be very helpful. The other thing I would do as much as you can, try to get in the gym and do strengthening things. And then yes, and again, this is not medical advice and it's considered experimental, just so you know that with the FDA, but I think that's where peptides potentially have a role, helping people get their muscle strength back. There's a number of peptides that potentially can do that. Not long term, not something potentially you do forever, but I do feel it for a month, 2 months, 3 months to help get muscle strength back. That can be very helpful, something to talk to your doctor about. And if you go that route, have it prescribed by that doctor and get those peptides from FDA approved or certainly legit compounding pharmacies, not these peptides sold online that may or may not be peptides. They may or may not have contaminants. Lots of issues. I've talked about that way too much, but that's where potentially that could have a role. Physical therapy twice a week. Yeah, I think that's definitely a good start. But it's tricky. And at 4 months, again, I don't do joint replacement surgeries, but I think what most joint replacement surgeries would say is it's a process and it's about a year before you're as good as you're going to be. So you just have to keep plugging away at it in that sense. And she says, maybe because I'm 76. I mean, that's true for everybody. Muscle mass is hard to regain as we get older. That's certainly true. But everybody after that major surgery would struggle with that. So I wouldn't beat myself up about that. There's a number of others, and I'm not giving recommendations on peptides because, again, this is not medical advice, and because peptides are considered experimental. I do talk to my patients in my practice about different options, but I am not going to put something like that publicly on as a recommendation. It would not be. But I have videos on a variety of different peptides in the modern medicine section on my channel, so you could potentially check that out. Mike says, haven't been able to play sports in 2 years, coming back to training, felt good, legs slipped, now I feel like I can't trust it. Yeah, I would want to know what the source of that instability was. Is it ligament instability or is it muscle weakness that's causing subjective instability? It doesn't seem likely, but I've seen that, so that would be what I'd want to know. So that may be involved getting an MRI. Still squat, bend with no pain, but it feels unstable. Yeah, that's kind of, if it was a patient of mine, I'd want to know what the instability was, potentially get the MRI. All right, thank you so much. We're going to stop there. I apologize for the audio issues earlier, but very, very grateful that you were there. We got a big crowd today. Very excited about that. I will be back here October 18th doing Ask Dr. Geier Live. Have a number of videos coming out over the next couple months, one a week, that are mostly answering your questions, so you can certainly leave those in the comments to videos, or like I say, join us October 18th. Very, very excited. Hope you have a fantastic weekend as we head into fall, and I'll see you very soon. Take care.